Okay, so this is going to be the wound station practice. This is the first attempt. I'm really just winging it on camera, but I'll tell you guys what I did to get to practice this station. So I got the fundamentals of nursing, and what I do, what I'm going to do for everything is whatever I'm working on, whether it's a wound changing or cleaning the PICC line, whatever, I'm going to go in this book and find the steps, read the steps, go over the steps. And this is what you would do if you don't have any access to the internet to look at videos. But what I'm going to do is read here, and then I'm going to also look at videos, at least one or two. And the videos that I watched were B.J. Nelson and small x, capital C, capital D, number 4, just the number 4, not number sign 4. So small x, C, capital D, 4, N, small n, small I, small t, small r, small o, capital X, small x, number 1. I don't think that the whether it's capitalized or not, whether it matters. So I watched those videos on YouTube also. So in this book, page 969 is the steps for a wound change. Is the steps for applying a saline moistened dressing. So you will read it over this and to get familiar with it, and then you can watch the videos to see it and kind of get a hands-on, not hands-on, but you know, a visual of what you're supposed to be doing. So you put that book up. So now in this station, what I am expected to do, and this is the check off also. So what my CE is going to be looking for is, this is what the clinical examiner will have.
Did you get shot for?
I don't know if you can see that or not, but these are the areas, and it will say pass, fail, NA. I don't know what the T means, but
Got 10
here.
bandages.
So I am expected to review the medical record to determine the procedure to be performed, whether it's a wound care, peripheral inserted central catheter, PICC line dressing change, or intermittent urinary catheter insertion. That's A. B, I am to perform hand hygiene. C, verbally identify the patient by comparing two of the following pieces of information on the patient's identification band against the medical record. So 1, the patient's name, 2, the date of birth, 3, the medical record number. D, I am to assess the wound. 1, the wound. A, the type of wound, the location of the wound, the condition of the wound bed, presence or absence of drainage, condition of surrounding skin. So that's all. That's what I'm expected to do with the wound. But also I have to, where am I at? Maintain, 2, maintain asepsis. 3, maintains thorough technique when indicated. 4, wound management dressing as indicated. So A, remove the dressing without contaminating the wound. B, dispose of the dressing in the designated container. C, prepare packing with prescribed solution. D, cleanse wound with normal saline. E. Pack wound by 1. Applying 1 sterile moist dressing to the wound bed surface. 2. Applying a loosely fluffed dressing to wound bed surface. 3. Applying moist dressing so that the gauze does not extend beyond the top of the wound. And even though it says 3, this is 1 dressing. So it's saying this same dressing, apply it moist on a wound bed and make sure it's loosely fluffed on the wound, and make sure it doesn't extend beyond the top of the wound. That means the perimeter of it. F. Apply sterile dressing without contaminating the wound. G. Cover packed wound with a sterile 4x4. H. What are you doing? H. Cover 4x4 with sterile ABD pad. I. Secure the dressing. J. Label dressing with the date, time, and initials. So that's what you're expected to do. And then documentation. Pertinent data associated with clinical decision. That's 1. 2. Assessment data for wound. So you are to A. Procedure performed. Note the procedure performed. B. The type of wound. C. The location. D. The condition of the wound bed. E. The presence or absence of drainage. F. The condition of the surrounding skin. And that's it for the wound. So they'll check and make sure that you did everything properly or whatnot. So as far as documentation, you have to document the wound type, the location, the condition, the presence or absence of the drainage, and the condition of the surrounding skin. So my mnemonic that I came up with was TLCPC. The singers TLC, they like to do PCP. I don't know, just something to remember. Even just drop the P at the end. So that's just something I came up with so I could remember what to document on. So anyway, so let's proceed, and I need to make sure that I don't skip any steps. So I would get my supplies from Station A, Table 1. So I know I'm going to have to clean the wound, so I'm going to get my normal saline. I'm going to get my hand sanitizer. I'm going to need a clock to time myself. I'm going to need some tape.
Oh my God, so
Actually, I'm going to put this stuff on this side because I want to put my sterile stuff on this side, being that I'm right-handed. Some medium gloves. I'm going to need 1. I think it's 2 in here. No. Is it 4 in here? How many in here? 2 in there. So 1, 2, 3 to clean, side, middle, and 1 to put over. 1 to fluff it and put it in there, and then another 1 to put over it. My ABD. Just act like this is in a packet. Or maybe I should get something to act like it's in a packet. So I'll take this out. So act like this is in a sterile packet. I'm gonna need some clean gloves. I should be thinking of this stuff in order, actually. Clean gloves. So I got my clean gloves, so I'm gonna take off it. I'm about to take off the old dressing, throw it away. Oh, I need my tray.
I got. Thanks, Frank.
So anyway, so I got all my supplies, and I'm going
I
to
just don't know how I died now. Did someone shoot me? 'Cause I was like,
review the medical form. So anyway, so I couldn't find, and I'm waiting on a response to figure out where to get the Aspire and the patient scenario so I could actually read it and figure out what procedure I'm supposed to be doing. I can't find it. So
it's like 2
anyway,
minutes
so
left.
I'll enter the room. Hello, I'm Angela. I'm going to wash my hands. I'll wash my hands. Come back. I would just provide privacy by closing the curtain, the door, whatever it may be. I would sanitize my hand because the hand gel was here for something.
Slow it down. Where we jump off was.
I just want to identify who you are. So can you state your name, please? And I will ask these things, and I will also look at the wristband. Okay, and your date of birth. Okay, so you only have to do 2 identifiers. If you want to, you can do 3 to be safe, but I'll just do 2. Okay, that all matches up. So I'm Angela. I'm a student. I don't know what we call ourselves. I need to figure that out. An EXCELSIOR student, and I'm here for my clinical performance, and I'll be changing your dressing as prescribed by your doctor. Are you in any pain right now?
Yeah.
No? Good. Okay. So I'm going to put the bed at a working height, which is usually up to elbows or whatnot. So first thing I'll do is I want to get my things in order. So I'm going to a trash can over here. Push this over a little bit more. That's why I should have a table, an extra table, but I don't have that much room in my living room right now for an extra table. So anywho, you can barely see, but you get it. You can see enough. So I open that. So because I'm right-handed, I'll be going to my left and grabbing this glove first. And actually, what I would do is put this up top so I don't reach over my sterile field. So I'm going to drop all my sterile stuff actually to the left, because this is I'm going to grab that glove first. So I'm going to, as if it was in the pack, pinch and open it, and then
Grant said when someone leaves, invite me.
I'll drop it on this side. Gotta be careful, because now that's contaminated. But if it was in the pack, it wouldn't be come out like that. So that's that.
Yeah.
Pinch it, open it.
Last time I texted him, he said fuck you. He said hey, and I said fuck you. So
And I'm actually gonna hold it this time so it'll fall exactly where I want it to fall. So as I said, I'm looking for a little study partner, someone that we both can FaceTime, and we can act as one another's CE. We can act as one another's CE via FaceTime or WhatsApp. So
this girl tweet.
I don't have the normal saline, so I just use this wound cleaner.
You don't know me, and that's at 4 a.m. We just fucking read something.
Write that in there. Oh, I guess I should have turned on a timer. I think you get 30 minutes for this. I'll get 25 on here because I think it's been.
Run straight to you guys. Oh, we got a record. Should I just
I think
take
it's
it,
been that at least 5 minutes. So I got that.
Should I take the red over?
I'm also going to go ahead, date 10/2/18, my initials, the time.
Alright.
What time is it?
That guy in the house up to the left here?
I don't know what time it is. I'll just say 8 p.m. So that's done. When I get ready to put that on there.
Oh,
it's already done. So now I will put my gloves on. Now I'm gonna check myself. I don't even know if I'm gonna put this video up or not.
We good. You can take your time with me. I got a knife here.
But I could put it up as my first attempt.
Oh no! Hey, Frank, get him! He stands up.
Hey!
Yes, sir.
So here's my little wound. I don't know if I can get it to come a little closer or not. There we go. Yep. There we go. So it's just my mannequin head that I had, and I just put a hole in her neck, made a wound for her. So loosen up the edges. Once you loosen it up, just grab everything and throw it away. I'm not going to toss it because I'm going to use it again. Throw it away. So I'm going to look at it, the type of wound, the location, the condition of the wound bed, the presence of any drainage, and the condition of the surrounding skin. So that's that. So got that done. So I need to clean it. So I probably, some people already have it in there, but I don't understand how they already have that in there. So I don't want to get the gauze from in there because I guess I would contaminate it. But I don't see how I would contaminate it if I got just one thing off top. Well, 4. So anyway, next time I'll just put them in here, but just get it. Really, I'll just get.
Nice.
So this is sterile. But I'll just pour some more on top of that. Actually, I don't have to really wet my gauzes that I'm gonna use to clean it. I can just play along with that. So it's wet. So I'll do side, throw that away. Side, throw that away.
I already hit the cheeseburger where the rest is.
metal, throw that away. So now it's clean. So now I would dispose of my gloves, and I'm grabbing it on the outside of it and carefully rolling it so it doesn't like that. Put that in my hand and put my fingers under there and dispose of it. Now I'm gonna sanitize my hands again. And now I'm going to put on my sterile gloves, grab the right with the left, and going to put my hands in there without touching anything other than this folded part. Oh, y'all can see that. Got that on. I'm not going to play around with that. Just leave it be. So now I can move these things to the side. Grab my other one, the cuff under. My hands in there. I can go around and move it. And then I can use this hand to put that down. Got that? Keep my hands above my waist. So now I have my gauze. And I'm going to squeeze the excess with normal saline. Gonna open it up. This might be too much light also. I don't know. Try to open it up. There we go. Open that up. Then I'm just gonna triangle of the ends. That look like it's too much light. So when you initially get in there, you want to make sure it don't hit the outside, go beyond the borders of the wound, because if it does, you're in trouble. So I got it kind of small there. And then I'll sit it in there. Make sure it doesn't go over any of the borders. And then put it in there gently. Probably good to keep it wet. The wetter the better, because it'll stay in place. So if it touch any of the outside of the skin, then it's contaminated, and I guess you would fail. So I'm just gonna bring the camera closer so you can see. Of course, we know I'm about to contaminate my gloves, but it's just so you guys can see how I packed it in there. So don't even worry about that. So I'm trying to keep it on here, so I packed it in there. Let's see there, so it wouldn't go over on the, shouldn't go over.
Hey, this wasn't my open.
So that's that.
Exclusive buys.
So anywho, so I did that. So now I'm gonna take a dry 4x4. This was the 4x4. I'm gonna take a dry 4x4 and I'm just gonna place it on there. Don't move it around because I guess that means it's contaminated. And then I'm going to take the ABD pad and just drop that on there. And now I can take off my sterile gloves. I'm going to reuse these, so.
So.
I guess I will do another video and just do it instead of really talking. I'm gonna do it as if I'm really, you know, getting tested. So anyway, so now get my tape. I already put everything on here that I need to put, and I wouldn't do the corners. I'm gonna do 3 strips or whatnot. Then I'll clean my mess. So next time I'll throw everything away too. As if I was really doing it. So. Guess I'll keep that on there. But I guess I'll do all this off camera. But anyway, so clean up my mess. And okay, so the wound dressing is complete. Do you have any questions or concerns? No? Okay. Are you in pain now? No? Okay. Was that uncomfortable for you? No? Okay. So I'll put your bed back down. Are you comfortable? Do you need anything? No? Okay, good. And that is it. Oh man, I'm just having problems with this thingy. Okay, so that's it. First go around, I'll watch the video, see what I think. But I'll do that's my first attempt. I'll post the first attempt. Oh well. And then I'm gonna do it again probably later on tonight and post my second attempt and make sure that I do everything right, so I won't have to go into my sterile field and put the gauzes in the saline or whatnot. Got to get a good flow. So my next video, I would like to have a good flow. So thanks for watching, subscribe, and that's that. So what I'm going to do actually is, just to let you guys know, I'm going to watch the video and I'm going to check myself off. So I'm going to act as my own CE and see if I passed or if I failed. And this one I for sure failed, but my second attempt, I'm going to make sure I do everything that I'm supposed to do to make sure I pass. So this is just a little rough draft of feel of what's going on, what I'm doing. So that's that. Thank you, and I will see you later. Oh wait, how long did it take? That took 20 minutes. All right, bye.